Hello, everyone. Welcome. Welcome to Birth Control Trendy Tuesdays. I'm Iris, and I'm here today with CEO and co-founder of Pandia Health, Dr. Sophia Yen. Every Tuesday, Dr. Yen addresses popular birth control questions. And if you're into Spanish, you should listen to the video we just put out. Before we get started, make sure that if you already have an active prescription for birth control, sign up for free delivery and automatic refills with Pandia Health at pandiahealth.com. If you need a prescription and are currently living in California, Florida, or Texas, you can sign up for an online doctor's consult with one of our expert doctors to get a prescription. So if you do sign up for any of our services, make sure that you use the code TRENDING as seen down here in the little crawler, so that we know you heard about it from us. So today's topic, as you can see, is birth control side effects. There's a lot of different worries that people have when they take birth control, so we want to make sure that we answer your questions so that you're better informed when making these decisions. And Dr. Yen has a lot of expertise in this area, so we're very lucky to have her to answer these questions. So I guess the first question is, can birth control cause infertility?
So the joke I like to say is, yes, it causes infertility while you're using it, because that's the whole point of birth control, is to prevent fertility, prevent pregnancy. But the real question is really, when you stop birth control, will it have long-term effects on your fertility? And for the birth control pill, patch, ring, the IUD with hormone, the normal IUD, the implant, the shot, none of these will cause you to be infertile in the long run. The only, all of these, you could get pregnant within 14 days or the period that you get after you come off of these medications, and then 14 days to allow the lining of your uterus to grow and get ready to catch an embryo. The only exception to this, like 14 days approximately after your first period, after you come off the medication, is the shot. The shot sometimes takes up to 8 months for fertility to get back, because it is a shot and it's stored in the fat tissue. And so there might be some residual medicine kind of working its way out of the system. But all of these methods, you should generally be able to get pregnant theoretically, and therefore use a backup method if you're not trying to get pregnant within 14 days of coming off the medication. And the way you know this is if you're on the birth control pill and you miss 3 days in a row, then all of a sudden you get your period, and then you know that medicine's out of your system.
Yeah. So are there no studies to show what the long-term effects are on the ovaries? Are there any long-term effects?
The main effect that's amazing with those that stop you from ovulating. So the pill, the patch, and the ring have a very good efficacy at stopping you from ovulating. The implant and the IUD with hormone, not as much so. Only 30% of those people stop ovulating, and 70% continue. But the benefit of stopping ovulating decreases your risk of ovarian cancer. So if it does anything to your ovaries, it makes it so you have less cancer.
I was reading an article about that the other day. That's really cool.
Yes, the number one way to decrease your risk of ovarian cancer, other than taking them out, is by stopping ovulation for about 5 years would be optimal. That decreases your chance by 50%.
Yeah, so that's great. That's a positive side effect of birth control.
A bonus.
A bonus. And I guess you kind of answered this one, how soon you can get pregnant after you stop taking the birth control pill. So you said 14 days after for most, except the shot, right?
Yes, exactly.
Okay, so you can, as soon as you stop taking the pill or your hormonal birth control, you can try, and there's no increased, risk or delay because you were on birth control.
I think what has happened in the past is that physicians used to say, come off your medications for 2 or 3 months before you start getting pregnant. And the main reason is we as doctors like to have an exact date that how far along you are. And we count that from the first day of your last period. But if you immediately have sex right after you come off, then we don't know what that first date is. And as doctors, we don't like that. But we can definitely date you via the hormone level. But more accurately, they do it via ultrasound. So we now have technology that you don't have to come off for a couple months, the key thing is to make sure that if you want to get pregnant, make sure you have the maximum nutrition to support the future baby that you're going to grow, and take a prenatal vitamin, ideally for, 6 months or a year, but at least a couple months, so that you have enough folic acid to prevent spinal tube defects, but just to maximize your nutrition, to catch anything that you're not gonna necessarily eat because you didn't know or whatever like that. So that way your future baby will be the best that it could be.
Yeah. So if you're planning on getting pregnant after you stop your birth control, make sure that you're prepared. You're preparing your body to like be a little house for the future baby, and if not, then use protection in other ways. I guess another kind of scary side effect that some people are considering when they look at birth control is weight gain, because there are some horror stories out there that some people say. So what can you tell us about that?
Yeah, so the research shows that if you put 100 women on the pill, 100 women not on the pill, the 100 women on the pill on average will weigh a pound less than the women not on the pill. And it's because the women not on the pill are bloating up, bloating down, bloating up, bloating down, are having the hormones go up and down and up and down. And so they average a pound more because of this bloat. And then the people who are on the pill are just kind of smooth and then bleed, and smooth and bleed as frequently as you want to bleed. Or for those of us, you can never bleed if you want, if you're on the birth control pill, patch ring, or some other method. So the research shows that it does not make you gain weight. What it is a lot of women also start the birth control pill, patch ring during college. And as we all know, there's the freshman 15. Right? So then you are on the pill and you gain 15 pounds. You're like, that dang pill, patch ring. No, it was your freshman 15. Also, the average American woman gains weight over time, and we shouldn't. If you look at other countries, Japan, that is one of the most healthiest countries, you should just stay the same weight once you're in college. Once maybe you get your freshman 15 and then you're done. And anything above that is extra, because you are done growing in height. So you should not be growing in weight. And so you should just be maintaining. And so the weight is just part of the American lifestyle. However, I want people to take home the message that there are 40 different pills, there are different levels of progesterone, but there are 8 different progesterones. And each woman responds differently, though most do fine. 95% have no issues, but the 5% that do, we want to help you and make sure that it's optimal for you. Different women respond differently to different progesterones. So just because one pill didn't work for you, that exact same hormone at a lower level may work better for you, or there's 7 other different progesterones that you can try. So make sure, if you know that you have a side effect with this one, you know what the name of it is. So that way the doctor can write you a different one or a different dose. So know the name and the dose. So we're always like, is it norgestimate? Is it drospirenone? Is it norgestrel? Is it levonorgestrel? And is it 1 milligram or 1.5 milligrams or 30 micrograms or 35 micrograms? That way we can be like, she didn't like this one. Let's play with this and do this. And know that just because you failed the pill once, 39 other flavors you can try.
Yeah, so you may gain weight, but it depends on the person. It depends on the lifestyle. Like you said, Americans tend to gain weight. And then it depends on the pill too, because there's all these different hormones which may interact with your body differently depending on who you are.
Yes, but the research in general says you gain weight.
Yeah, because of the fluctuating hormones. Which is good that it does calm them down. It's a nice little break from all the fluctuating hormones, I guess. And I guess another side effect that some people are worried about is acne. So some people, their acne decreases, but some people are worried that they're going to get more acne. So what can you say on that?
Yeah, so we have a lot of patients come to our platform and they're like, I want this drug for acne, or I want this drug for acne. And the research has shown all of them work for acne. And the reason why is when you have acne, your hormones are a little out of whack. And as we mentioned before, the birth control pill, patch, or ring stabilizes that hormone. Also, a lot of the progesterones in the newer pills decrease the amount of circulating testosterone that's running around. And the more testosterone you have running around, women do, or those with uteruses do have testosterone. And the more of it that you have running around, the more likelihood you have of having acne. So by going on the birth control pill patch or ring, it boosts this thing that binds the testosterone. So you have less testosterone, less risk of acne. And this happens with any birth control. But I personally don't like levonorgestrel or norgestrel. Those are the older progesterones known to have more of these kinds of side effects. But again, the research shows any method is better than no method on your acne. But if you notice that this particular progesterone gives you worse acne, then let's try a different one. And what's crazy is the research shows this one should give you the least amount of acne, and I've put people on it and they're like, my acne got worse. And I was like, the research shows that should have totally dropped your testosterone and, you know, made your acne better. So again, it might be a confounder, an effect that we aren't measuring, such as if you're hitting your acne sometimes will only get worse before it gets better. And if we hit you as you're going worse, you attribute it to the birth control pill, but it would have been even more worse if you had not been on the birth control pill. Or maybe now that I always love to blame stuff on relationships. Now that you're in a relationship, you're stressed out, and so you get more zits.
Yeah.
Before
I didn't know that. Oh, go ahead.
No, go ahead.
Oh, that I didn't know that the birth control pill or like the hormones actually like trap the testosterone from circulating. I thought that they'd like decreased it or something, but that's really interesting.
What they do, if you want to know the technical for any pre-meds or meds or healthcare people, is there's a thing called the sex hormone binding globulin. And somehow certain birth control pills, particularly norgestimate, drospirenone, or desogestrel, increase the level of this sex hormone binding globulin. And then the testosterone sticks to it, and then there's a lower level of testosterone. As you may be alluding to, there's a syndrome called polycystic ovarian syndrome, and those women, their hormones are all whack, and a lot of it's getting turned into testosterone. And so by turning off their natural hormone that they're making, then we decrease the level of testosterone for those women, as well as increase sex hormone binding globulin to bind any extra testosterone that's running around.
Yeah. To learn more about polycystic ovarian syndrome, check out our blogs on Pandia Health. And I guess another thing that is like a scary thing that may dissuade some people from taking birth control is how it could affect their moods. So some people think that you're going to get depression and are worried. So what advice would you have on that?
Yeah. So there was a giant research study in the New England Journal of Medicine, and a bunch of, I forget if it's Swedish or Danish people, like I want to say it was either 20,000 to 100,000 women were studied. And they noticed that those who were on birth control were more likely to have a diagnosis and or prescription for a depression medication. And so it was thought that the average rate is 1%, but if you're on the birth control, pill, patch, ring, or IUD with hormone, anything with hormone, it increased your risk to 2%. And so some people would say, oh my goodness, that's 100%. It's a doubling of the percentage. But the reality is it's a difference between 1 to 2%. And maybe the benefit to the 98% of the women who don't have that side effect is better than the risk of 1%. And certainly every woman has to take it upon themselves. But I think there's also possible confounding factors in that those who are on the birth control, pill, patch, ring, or whatever are seeing a doctor. And so there's a doctor there to be like, are you depressed? Are you sad? And then diagnose it and then give them the prescription. Whereas somebody who's not, nobody's following them. They may not be going in for a checkup for years, or they just may not show up as often. And therefore nobody's asking, are you okay? Are you okay? Are you okay? Because I would say in general, 10% of people are depressed. So that prevalence was even lower than I would expect in general, you know? And the other risk factor, I think, is looking at, well, what about the stress of being the possibility of pregnancy? So I always want the method that has the least amount of risk of pregnancy. And that causes me far more depression, anxiety, like if I'm having sex, I want to enjoy it. I want to be like, woohoo, instead of I'm gonna get pregnant, right? And if I'm using a good method, then I can be like, woohoo. Whereas if I'm not using a good method, then I'm going to be a little stressed out. And then I also think there's the factor of significant other. If you're in a relationship that requires birth control, then there's a significant other that you are having an interaction with. And so I ask our teenagers always, you know, who's most likely to make you want to kill yourself? Your significant other, because who's going to break up with you, cheat on you, do something sad, say something mean, forget your birthday or for your anniversary or whatever, the significant other. So that's going to cause depression and anxiety. And I wonder if they controlled for that.
So. That's really interesting. They should probably include that in the next study that they do. And I didn't know that 10% of the population. Oh, go ahead.
Yeah. So 10% of the population in general, I would say, has depression at some point. And it's a huge percentage of teenagers that have wanted to hurt themselves or kill themselves. It's just, you know, sometimes life gets overwhelming and you go there, but also the hormones going up and down. And so if you can stabilize the hormones, the psychiatrists actually have told me it's better for women to be on the birth control pill patch ring with stable hormones than off, because this whole up and down is actually not natural. In the old days, we were supposed to be incessantly pregnant or breastfeeding, 0 periods. And now we're having 350 to 400 periods versus we used to have 100 periods. And so we're cycling up and down and up and down and up and down 350 times versus over here, we were only doing that 100 times in our life. So the psychiatrists, I've had a couple psychiatrists because, you know, I'm always looking for data. And they're like, it's better for the patient to be on the birth control pill patch ring. And ideally just smooth. Don't do 3 weeks on, 1 week off. Just be smooth, because everything is better smooth. Depression, diabetes, seizure disorder, migraines, thyroid, anything that you want to keep smooth. Smooth is always better than this. Unless, of course, it's way too high or something like that.
Yeah, they don't teach you that when you're in school. So that would have been nice to know. It's like advocate for young people to stabilize their hormones as early as possible, I guess. But yeah, that's awesome.
I've seen our patient care advisors here. I see Kim and Courtney.
Hello. Well, thank you guys for joining. Every Tuesday, we're going to be here answering questions on birth control trends or just any questions you guys may have. So make sure to submit them. And yeah, we're going to be here with Dr. Yen, CEO and co-founder of Pandia Health, who, as you can tell, is very knowledgeable on reproductive health. So make sure to check out Pandia Health's birth control delivery service at pandiahealth.com and use the code trending, and follow us on all of our social media. We have YouTube, we have Facebook, Instagram, and TikTok recently if you want to see some fun content. So thank you again for joining us, Dr. Yen, and sharing with us all your expertise.
Thank you, Iris, for running a fun session.
Thank you. We'll see you guys next week. Have a nice rest of your day. Bye.